All right, joining us now to discuss everything COVID is Dr. David Winter from Baylor Scott and White Health. Dr. Winter, thank you for being back with us again. We know this information is so crucial right now to so many people. So we've been seeing.
It's good to be with you, Jason. Thank you.
So we've been seeing children getting hospitalized with COVID more than we had in previous waves of this virus. Can you talk a little bit about why that is and what you're seeing?
Yeah, the majority of patients, both young and old, hospitalized are unvaccinated. And of course, most children the younger children cannot be vaccinated. So that's what we're seeing primarily. Fortunately, those kids tend to do pretty well. Very few go into the ICU, but we're seeing a lot of increase in people, both young and old, that are mainly unvaccinated, Jason.
Okay, so let's talk about these booster shots because we're still waiting on that important information to come down about younger people being able to get those boosters. How important would you say it is right now for parents to get that booster for their kids once those kids become eligible?
Yeah, boosters clearly help. We're still seeing, though, and particularly in my practice, lots of folks coming down with COVID. If they're vaccinated, they seem to do fine. They stay home. They're sick for 3-4 days. Some go a little bit longer, but very few have to be hospitalized, and those with the boosters do the very best. So it's not mandatory, but boosters sure make a difference. They sure can help.
Dr. Winter, you know that we've been seeing so many people just waiting in line, many of them for hours just to get a COVID test here in these past couple of weeks. Can you talk about the importance of testing right now?
Well, testing certainly helps, Jason, but if you've been exposed to COVID, come down with a runny nose, stuffy nose, little fever and aches, you can just stay home. If you stay home for 5 days, your symptoms go away, then you can actually stop the quarantine, wear the mask for another 5 days when you're around people, but that works also. So for mild cases, you don't have to get a test. They're helpful if you can find one.
And that's the key there, being able to find those tests. And I know that's been a real scramble for a lot of people, whether they're going to one of these testing sites or trying to find one of these home tests at any given store out there. Good luck finding that in stock right now. Can you walk us through the difference, though, between the PCR test and the rapid test? Because, Dr. Winter, you know how this works on social media. You see so many things written about different things and you don't know what to think anymore. Can you just give us the difference between those two?
Yeah, the PCR test is a test to test for the virus itself. So it's the most accurate test to tell you whether you have the virus and can be contagious. It takes longer to do, sometimes a day or two to get that test back, sometimes even longer. The rapid test tests for the antigen. That's a part of the virus, not the whole virus. It doesn't really tell you if it's a live virus or a dead virus, but early on with symptoms, if that's positive, you can probably be sure that you do have it. So they're very helpful in the front end. But the definitive test is the PCR, the viral test itself.
All right, we've been hearing a lot of concern from parents, of course, here in these last several days with this fast-spreading variant, and now the kids are headed back to school once again after they have been off for winter break and maybe have been mingling with relatives that they hadn't seen in a while. What is your advice to parents right now?
Well, certainly we worry about the spread of the virus to young people, and some of those young people who get the virus have no symptoms at all. So I would say if you've got some elderly parents, family members who are immunocompromised or frail, they need to be careful around those kids. I would certainly wear a mask around those kids, assume that they may be picking the virus up and bringing it home. Now for the rest of us, if we've been vaccinated, we're probably okay. Fortunately, we're seeing this virus, the Omicron variant, it's milder than the Delta was for most people. And so for most of us, we're fine to get it. Just quarantine, try to stop the spread, and we'll get through this hopefully all together.
As always, some really great information there, Dr. Winter.